first thing before IV cannulation, you need to explain the procedure to the patient and take his proper consent. So I will put a cannula in your hand. I will try to be as less painful as possible. Are you okay with it?
Yes.
Okay. So patient has given me the consent. The next thing which we need to do, we have to prepare our tray. So what are the things which is required for IV cannulation? So for IV cannulation, what I need is some cotton swab to clean and make the area aseptic. Then we need some gauze pieces. We need a, let's say, flush system to flush the cannula once I have secured it. Then I need proper size IV cannula. As you can see, I have kept a 20 gauge and 22 gauge cannula in my tray. And then I need a very important thing called tourniquet, which will help me in making my vein of my patient prominent. And let's say I'm cannulating a conscious patient, then I would need to maybe anesthetize with a local anesthetic before inserting the cannula. So I would need a syringe filled with local anesthetic, and I would need fixator to fix the cannula at the right place, and I would need IV line and the let's say IV fluid to attach to the cannula. So every equipment of mine is ready. Then again I will, since I have taken the proper vein of the patient, clean that area and then start my cannulation. I will take the non-dominant hand of the patient and I will inspect for a proper vein. So I can see prominent vein on the dorsum of the left hand of the patient. So what I will do to make the vein prominent, I will tie the tourniquet. So I am now tying the tourniquet. So I will tie the tourniquet, which will help in making the vein prominent. So I have tied the tourniquet. Then what I will do? I will make the area, sanitize that area. So I have taken the cotton swab and now I am sanitizing that area. At least for 30 seconds, I need to clean. And this is alcohol-based spirit swab. With the help of this alcohol-based spirit swab, I am cleaning it for 30 seconds. So minimum 30 seconds it should be there. So I can see very nicely the vein is prominent. So after cleaning the area, right, the next thing which I need to do is I need to don the gloves. So I will secure my gloves. So now I am going to secure the gloves. Okay. So once I am done with the gloves, what will I do? I will pick up the right size cannula which I want to use in this patient. So he is an adult patient and the appropriate size cannula for this patient should be, for perioperative purposes, should be 20 gauge cannula. So I have chosen the pink one, which is 20 gauge cannula. So full aseptically, I would take out this cannula. After taking out this cannula, always try to check the cannula. Always check the cannula, right? Whether the cannula is properly working or not. Take the stillet out. See the stillet is running smoothly through the cannula or not. And if you want, you can flush the cannula as well. Okay. So I can flush the cannula as well. Okay. So let's say I have flushed the cannula and refixed the stillet. Okay. So I have chosen the cannula. Now I will hold the cannula in my right hand. I will take the patient's hand, the vein which I plan to cannulate. Now there is a poke point and a puncture point. Poke point means where you are putting the needle, on what part of the skin you are putting the needle, and the puncture point when that needle is entering the vein. Now poke point and puncture point should be different. You should not insert the cannula directly over the vein. You should go from the side. And how you should be placed in front of the patient? It should be in the line of the side. You should be in front of the patient. If you are standing on the side, then there would be a chances of error, right? The error, right? So angulation error we call it. So it should be in the line of sight. So as I am in the line of the sight in front of my patient, right? So what will I do? With my non-dominant hand, I will retract the skin and I will keep it tight. Then I will take the cannula and from the, let's say, side, I will puncture the skin, right? I have punctured the skin and now I have entered the vein of the patient. So I have entered the vein of the patient. I can see the blood coming in the stillet. So after seeing the blood coming in the stillet, I will withdraw the stillet. I can see the blood coming in the cannula as well. Very gently, I will thread the cannula smoothly over the stillet. After that, I will apply pressure on the point of the cannula and I can take the stillet out. But before that, I would remove this tourniquet. So I am just opening this tourniquet of the patient, right? So I'm opening the tourniquet and then I'm applying the pressure and I am removing the stillet. So once I have removed the stillet, what I will do, I will take the stopper and I will fix it in the, I will close the stillet, okay? And then I will close it. And then I have to fix the cannula, okay? So this is the fixator which I will use. This is the fixator which I will use. Now what I will do, I will open the fixator, and this is a sterile fixator which we normally use. So with the help of this fixator, I can open my gloves now. Because of the gloves, there is a possibility that I won't be able to fix it properly. So I will open the fixator and I will fix it like this. I will secure the cannula. Okay. So I am securing the cannula. So I have secured the cannula. I may write the date on which I did the cannulation. Then I will take my flush system attached to this cannula and flush the cannula. And I will attach the IV line to the patient. So this is how we do the IV cannulation. We need to choose the correct size. We need to be, our puncture point, poke point should be different. I have to puncture on the skin, then go into the vein. And once I see the blood into my cannula coming, I would know I have punctured the vein. What will I do? I will withdraw the stillet a little and I will thread my cannula smoothly over the stillet, remove the stillet, and I will fix the cannula to the patient. So this is how we do IV cannulation. Thank you.